What causes auditory processing problems in adults? Have you ever wondered why some adults struggle to understand speech, especially in noisy places? This is often due to auditory processing problems, also known as central auditory processing disorder. It involves difficulties in the brain's ability to interpret sounds, even when hearing is normal. Several factors can lead to these challenges. One major factor is neurological conditions and brain injuries. Damage to the central nervous system can disrupt the auditory pathways and brain areas that process sound. This damage can result from strokes, traumatic brain injuries, tumors, or neurodegenerative diseases like dementia. Age-related changes also play a role. As we get older, our brains and auditory systems naturally change. These changes can make it harder to process complex sounds and speech, especially in noisy environments. This decline in auditory processing can occur even without hearing loss, although it often happens alongside it. Speaking of hearing loss, even mild to moderate levels can affect auditory processing. When the brain receives unclear or degraded sound signals, it becomes difficult to distinguish speech sounds or locate where sounds are coming from. Sometimes, people may not even realize they have hearing loss, but it can still contribute to processing difficulties over time. Sensory processing disorders and related conditions can also impact auditory processing. Conditions like sensory processing disorder or misophonia involve unusual sensitivities to sounds. While they are not classic auditory processing disorders, they show how the brain can respond atypically to sound. Factors like genetics, prenatal complications, anxiety, and environmental exposures can contribute to these conditions. Psychological factors are another piece of the puzzle. Stress, anxiety, and fatigue can worsen auditory processing issues. They can affect the attention and cognitive resources needed to interpret sounds. Emotional responses to certain sounds, as seen in misophonia, can further complicate normal auditory processing. Lastly, environmental and developmental influences matter too. Early life experiences, such as being born prematurely or having a low birth weight, along with exposure to toxins, can increase the risk of auditory processing issues later in life. Adults facing these problems often find it hard to follow conversations, especially in noisy settings, and may struggle to distinguish similar sounds. This can significantly affect their communication, work, and social interactions. If you suspect you have auditory processing problems, it is essential to seek a professional evaluation. An audiologist can help rule out hearing loss and identify specific processing deficits. Management may include auditory training, changes to the environment, communication strategies, or even hearing aids if needed. Cognitive behavioral therapy can also be beneficial for managing emotional responses to sound sensitivities. Understanding auditory processing problems is crucial for finding effective solutions. Consulting with qualified healthcare providers ensures you receive the right diagnosis and personalized care.